Good afternoon and welcome back. This is Linda Criticus from Your Nurse Advocate Consulting. And today I just wanted to review the role of a nurse advocate, or actually a patient advocate. The role of a nurse, part of her function as a nurse, is to always advocate for her patients. And that's just part of something we learned in nursing school way back in Nursing 101, and it is carried through all of our nursing career and all through our training. But the role of a board certified patient advocate or nurse advocate, and just so you know, a patient advocate does not need to be a nurse. But for this scenario, we are talking about Your Nurse Advocate Consulting, where there are two board certified nurse advocates at your disposal. Our role is much deeper in regards to advocacy. And there are 6 really important items that as nurse advocates, we try to impart and make as our guiding light as we take on clients and as we move forward in this new complexity of our healthcare world. One of the things that a board certified nurse advocate, such as one that you would receive from Your Nurse Advocate Consulting, make sure or ensures safety is maintained for the patients or clients that we take on. We want to make sure that patients are safe in the environments that they live in, whether it be in their own home, whether it be in an assisted living, whether it be in a facility of some kind. We try to ensure that the patient remains safe and has the tools in their home or in their environment to stay safe. So that's one of the first things. One of the most important things is giving patients a voice. My partner and I have been in nursing for a long, long time, and it could probably age us a bit if we told you how long, but I want to say it's almost 80 years for the two of us together, our combined diverse skill sets. What we try to do is give patients a voice. Patients who are medically fragile and who need to learn how to navigate this very complex healthcare system that we are currently involved in. Our role is to make sure that we give them a voice and help them with or what I would call translate the information that is being given to them by their healthcare providers. We help them make sense of it so that they can make informed decisions in regards to their healthcare, so that they can feel comfortable with the care that they're receiving and that they're getting the right care at the right time by the right people in the right environment. A lot of times it's as simple as just explaining the diagnosis that they were just given, or explaining a new treatment regimen, or explaining the complexity of all the medications that they are on in regards to their new diagnosis, or even a current one that's now exacerbated or it's chronic. A lot of times we're there as a support system to help them, give them that voice so that they can ask the right questions to get the answers that they need. Part of our role is also to educate not only the patient, but also their health providers in regards to the individual's health history, especially if there is so much complexity in regards to the patient's diagnoses and comorbidities or the care that they're receiving, or if they've been sick for a long time. A lot of times being that voice and helping educate the health providers in regards to treatments that they've had, medications that they've been on, really helps with the decision making and the overall expediency of the treatment plans that the individual may be receiving in the future. We also help educate the family and significant others in regards to how better to provide quality care in the environments that they're in. If they're in a facility or an assisted living, we also help educate the staff there to make sure that they understand what is going on with that individual and what their needs are. We also help educate the community, as we do now through our YouTube videos and through our blog posts and through our workbooks and worksheets. we try to help educate the community on the importance of advocacy and the role that advocacy plays in our complex healthcare world. One of the other things I wanted to just talk about is we try to protect the patient's rights. Patients have rights, and every time you go into a hospital, you're given a list of rights that you are to read and sign and understand. You have rights to be treated with dignity and respect, to have your information given to you transparently and in your best interest. You have the right to refuse treatment and in all care. What an advocate tries to do is help protect those rights for you, help make sure that those rights are established and kept in place and protected from any type of outside influence that may deviate from what you actually have as a right. We also try to double check for errors. This healthcare system that we live in is extremely complex, extremely changes minute. So double checks. We do Medicaid or Medicare checks in regards to making sure that your health insurance is, where it needs to be, and that you're getting the right benefits at the right time, and that and maybe give you recommendations about a better program that might suit your needs better. We also work with you on your medications and do complete medication reconciliations to make sure that you're not getting two of the same type of medication, they just have a different name. Unfortunately, in our healthcare system, our physicians don't always necessarily, or our healthcare providers don't always necessarily talk to each other. A lot of times they rely on the patients to provide them with the information that they need to make informed decisions regarding the care and treatments that they will provide. But a lot of times, because of when we go in to see a physician, we may not always be feeling well. We may not always remember that, oh, that doctor put me on that. Oh, I developed an allergy to that. That's where an advocate comes in. We help you with that. We help remember that. We make up those lists. We make sure that your physician has them. We make sure that you have a plan of care that is sent to the physicians that are caring for you. And we help those physicians with that communication. So a lot of times we have more than one healthcare provider. We may have a cardiologist, an endocrinologist, a pulmonologist, a general practitioner. We help pull all that information together and make sure that each provider that is working with you has that shared information. So you're not constantly reiterating that history and possibly forgetting things that may be important in regards to your care or treatment. So we try to make sure that the errors are limited to none. And we try to make sure that anything that we do in regards to medication, that your pharmacy is aware, and that your physicians are aware, and that you have a current and up-to-date medication list, and that you always have it with you in case of an emergency. It is really important in this day and age to have those advocates. If for some reason it's difficult for you to obtain an advocate, you can always contact us and we can help you obtain an advocate in your area. We are the resource gurus. We help find resources and help you get the resources you need. We help put resources in place for you so that you can live a quality of life. We can't travel all across the United States. So we will help provide you or help get you set up with someone that might be in your area that can help provide you with the services that you need. But one of the advocate's biggest role is to make sure or to help provide you with resources, whether they be community resources, medication resources, or getting you in contact with the ADRC to help you get those resources that you might be entitled to that you may not be aware of. So our role is to make sure that we always ensure and try to maintain a safe environment for our patients, that we try to give patients a voice in regards to their health care to make informed decisions. We educate both you and the community and your family and the facilities and whoever else we need to educate to make sure everyone is on the same page. We protect your rights as a patient. We double check for errors in regards to your insurance, to your explanation of benefits, in regards to your medications and or your treatment plans. We also act as a resource and help you obtain the resources that you need. A lot of times people have said, well, why haven't I heard of advocates before? Why haven't I heard of advocacy? Well, nurses have always been advocates, and advocacy has always been a part of healthcare. But now more than ever, with the complexity of our healthcare and with the short staffing that hospitals and clinics and doctors' offices and other areas that provide healthcare are experiencing, a lot of things can fall through the cracks, and not necessarily intentionally. Most of the time it is totally unintentional, but it's important to have someone in your corner to help decrease that level of error or things falling through the cracks due to clinicians being short-staffed, overworked, overtired, or because of all the constant changes that are happening within our healthcare environment. So I wanted just to leave you with one little thought, that a healthcare advocate works for you. You are in charge, you are in control. We don't make decisions for you, but we help give you the tools so that you can make informed decisions in regards to your healthcare and the way you want to see your healthcare delivered. Thank you, and I look forward to you on our next video. Thank you.